Hi, my name is Nayan. This is going to be part two on the mental illness video that I made a few days ago. I actually reviewed it and I made a few notes about what I can elaborate on. So I guess the first thing I'm going to talk about is the my experience with the NHS when it comes to how they help me with mental illness or like depression and that sort. So when I initially first, like in my previous video, I said I was like about 17, 18 when I started experiencing quite serious symptoms of mental illness. So it was a combination of like depression and paranoia and then anxiety as well, and then just becoming psychotic. So at that time, I guess my GP didn't really help me that much because of the way your doctor can only work with what you give them. So if you don't understand what's going on yourself, and if your family don't understand what's going on either, then your GP can't exactly help you, and they'll make judgments based on what you give them. So depending on what kind of doctor you've got, I guess it comes down to experience or lack of experience as well. So initially, the first step is for me it was like it was hard to talk. It was hard to explain because when I was 17, 18, I didn't understand the concept of inner self or in the inner voice or the inner critic. So I had no concept or no understanding of my inner self. So when I went to my GP, I said that I was like I have a voice in my head, but my GP didn't understand that. What I was trying to say was that okay, like I have an inner self, I have an inner conscious, and it's like I'm trying to understand what my inner self is trying to tell me. So like it comes down to misunderstandings and misinterpretations basically. Uh, and the thing about seeing like a GP or a doctor is like you only get 10 minutes. So you have you cannot develop a relationship whatsoever. So if you're seeing just like a public GP, which is like free, I guess. Yeah. It's you don't develop a relationship whatsoever. It's all mechanical. So they don't have any understanding. So like they could misjudge you, misdiagnose you, whatnot. And I guess in a sense, things go unnoticed or unacknowledged or yeah. So, but in a way, I didn't end up getting the help because of I was in college then, so I'd left school and then I'd gone to college. So, and I was talking to a counselor whilst I was at college, and he understood what was going on because I'd seen this person twice a week, sometimes every single week, every week for about 6 months, for about 6 7 months, and that was thanks to it was a student support counselor. So that was talking to him like really cleared things up because that way there was somebody that actually understood me. So it was I did end up going to see a therapist as well, like through the NHS. So like there's a low intensity therapist and then there's like a high intensity therapist. So there's high intensity therapists is for those with like paranoia or psychosis, and then low intensity is like less urgent, sort of like you're not in immediate danger or you're in danger to anybody else. So um, but it's less urgent basically. I guess, but you sort of get passed around a lot. You get passed around from one person to another, and it's like okay, I'm not qualified or I'm not in a position to help you right now, so I'll just pass you off to somebody else, which is a shame really because like most of the time, in my experience, all I wanted was somebody to talk to, or somebody to help me understand myself, and it's hard to find, especially at that age, 17, 18. What I learned when I was about 17, 18 is like it's like a transition phase from like teenage from a teenager to like a adult, like young adulthood. So there's some like everybody's heard of like something called midlife crisis, but no one seems to acknowledge there's something called a quarter life crisis as well, which happens around about 18, 19, 20, which is basically the same thing where it's just you just sort of break down, your brain sort of rewires itself, and then in order to prepare you for the next 10 years or something like that. Apparently the brain is supposed to like go through like a change every 7 years or something like that, like a pruning of the neurons or something. Yeah, but coming back to NHS, so in the mental health sense, it's like it's quite grey because like it's quite grey, it's quite mixed because some people, if you're able to articulate yourself properly and you have a good understanding of what's happening, then they can help you quite well because you're able to articulate your problems. But then there are others that struggle to do that, so you don't get the help. You either get the help or, well, no, it's not just that. You can, even if you do articulate your problems quite well, like it can be a really, really long time. It can be up to like 6 months or something like that before you see anybody, to be honest. By then, the problem would have escalated quite substantially. It would have escalated quite substantially, or it could have abated, so like you could have recovered from whatever it is you're going through. So what else is there? It's different to seeing a counsellor on the NHS is really, really hard because you have to have a reason to see a counsellor. Instead of seeing a counsellor like a private counsellor, which is what I've been seeing for the past 2 years, which is quite because like you're basically paying them out of your pocket, so you can see them as and when, so you can tailor it around to your needs. So like there was a time where it was like once a week or sometimes even twice a week that I used to see this person, and then sometimes it was like once a month. So it was like I could tailor it around my needs, and that's a good thing. That's one of the massive benefits about seeking a private counselor. Yeah, so talk about experience with the NHS. I can't really comment on being inside a hospital because I've never been inside a mental health hospital. I've had doctors from hospital come visit me to keep an eye on me, but to monitor me. So that created conflict with my family as well because of the difference in attitude towards mental illness, which can severely impact whether you get help or not, especially if you're a child or a teenager. The next, I think the second thing I'm going to talk about is the meds I'm on actually. So the first meds I'm on, or the first medication I'm on, is sertraline. So sertralin's an antidepressant, which I've been taking since 2013, and it's helped me tremendously. So let's see. I'll just read this out because this is like the leaflet that I get in my medication. So let's see. So there's 50 milligram film coated tablets. Sertraline contains the active substance sertraline. Sertraline is one of a group of medicines called selective serotonin reuptake inhibitors, SSRIs. So they're used to treat depression and prevent a reoccurrence of depression in adults, social anxiety disorder in adults, post-traumatic stress disorder in adults, panic disorder in adults, obsessive compulsive disorder in adults and children and adolescents aged 6 to 17 years old. Depression is a clinical illness with symptoms like feeling sad, unable to sleep properly, or to enjoy life as you used to. Obsessive compulsive disorder and panic disorders are illnesses linked to anxiety with symptoms like being constantly troubled by persistent ideas obsessions that make you carry out repetitive rituals. Yeah, so I don't know, I guess I wanted to talk about the side effects of the meds as well, because warning and precautions if you have outbursts as well. I guess one of the main things, because like it's about the perception of the reason why I'm talking about my meds is like it's a perception around taking medication, which is initially it really impacted me, because like it was like, who do I trust? Do I trust my parents who say that don't take this because you'll be on it for life and people think you're like a freak? Or do I trust the doctors that are trying to help me? Okay, so with sertraline, there's possible side effects. So these are like common, may affect 1 to 10. If you have manic episodes, reactions here. Okay, so common side effects for sertraline: sore throat, anorexia, increased appetite. So common meaning affects 1 in 10 people. Depression, feeling strange, nightmare, anxiety, agitation, nervousness, decreased sexual interest, teeth grinding, numbness, tingling, shaking, muscle tense, what? Abnormal taste, lack of attention, visual disturbance, ringing in ears, palpitations, hot flush, yawning, abdominal pain, vomiting, constipation, upset stomach, gas, rash, increased sweating, muscle pain, erectile dysfunction, chest pain, joint pain, and malaise. So this is a common side effects for taking sertraline. So, and then these are like uncommon side effects, so may affect up to 1 in 100 people. So chest cold, runny nose, hypersensitivity, low thyroid hormones, hallucination, feeling too happy, lack of caring, thinking abnormal, aggression, convulsion, involuntary muscle contractions, abnormal coordination, moving a lot, amnesia, decreased feeling, speech disorder, dizziness while standing up, passing out, migraine, enlarged pupils, ear pain, fast heartbeat, high blood pressure, flushing, breathing difficulty, possible wheezing, shortness of breath, nosebleed, inflammation of the esophagus, difficulty swallowing, hemorrhoids, increased saliva, tongue disorder, burping, eye swelling, purple spots on skin, face edema, hair loss, cold sweat, dry skin, hives, itching, osteoarthritis, muscular weakness, back pain, nighttime urination, unable to urinate, increase in urination, increase in frequency of urination, problem urinating, urinary incontinence, sexual dysfunction, female sexual dysfunction, menstrual irregularities, swelling in legs, chills, fever, weakness, increase in liver enzyme levels, weight decrease, weight increase. That should be in one of the most common ones, like weight, because like you sort of gain weight, or like one of the massive side effects. And these are like rare, so it may affect up to 1 in 1,000 people. Intestine problem, ear infection, cancer, swollen glands, high cholesterol, low blood sugar. Physical symptoms due to stress or emotions, drug dependence, psychotic disorder, paranoia, suicidal thoughts, sleepwalking, premature ejaculation, coma, abnormal movements, difficulty moving, increased sensation, sensory disturbance, glaucoma, tear problem, spots in front of eyes, double vision, light hurt eyes, blood in the eyes, problems controlling blood sugar levels, diabetes, fucking hell, heart attack, slow heartbeat, heart problem, poor circulation of arms and legs, closing up of throat, breathing fast, breathing problems really. Yeah, sore mouth, tongue ulceration, tooth disorder, tongue problems. They've just basically listed every single possible disorder you could think of. Skin problems, blisters, hair rash, hair texture abnormal, skin odor abnormal, bone disorder, decreased urination, urinary hesitation, excessive vaginal bleeding, dry vaginal area, red painful penis and foreskin, genital discharge, prolonged erection, breast discharge, hernia, drug tolerance decreased, difficulty walking, semen abnormal, increased in blood cholesterol levels, injury, relaxation of blood vessel procedures. Yeah, so that was rare. So that's like 1 in 1,000 people experiencing these types of side effects. These side effects are enormous. I've read these side effects before, but fucking hell. Yeah, so I've never actually experienced half these side effects apart from, I guess, increased appetite. What else? Lack of attention, numbness. No, I guess teeth grinding. Abnormal taste. Agitation, anxiety. Decreased sexual interest. Feeling strange. Nervousness. I guess those are the common. So they affect like 1 in 10 people, really. Yeah, so the reason why I'm talking about, let me just, that's the first medication I'm on. I'm only taking 150 milligrams of this, so it's like, it used to be 50 milligrams, then it went up to 100, then it went back down to like 75, I think. Then it went up, I'm on 150 now, so it's sort of fluctuated, and it's sort of gradually increased over the years, which is like, it's not good really, because I don't want to be on medication forever. The next medication I'm on is quetiapine, which is another type of antipsychotic. Okay, so what is quetiapine? What quetiapine is and what it is used for. Quetiapine contains a substance called quetiapine. This belongs to a group of medicines called antipsychotics. Quetiapine can be used to treat several illnesses such as bipolar depression, where you feel sad. You may find that you feel depressed, feel guilty, lack energy, lose your appetite or can't sleep. Mania, where you feel very excited, elated, agitated, enthusiastic or hyperactive, or have poor judgment including being aggressive or disruptive. Schizophrenia, where you may hear or feel things that are not there, believe things that are not true, or feel unusually suspicious, anxious, confused, guilty, tense, or depressed. Yeah. So I'm not going to read about the warnings or no, because I want to look into like I do want to look into like the side effects, because the side effects are some of the most underlooked sort of, or overlooked in terms of like the perception of what taking medication is. So like all medicines, this medicine can cause side effects, although not everybody gets them. The same goes for like the sertraline, because like not everybody gets side effects. Some people get 1 or 2 side effects, some people get like multiple side effects. So very common. So this basically affects more than 1 in 10 people, so maybe like 2 or 3 people, or 1 in 5 people. Decreased level of hemoglobin, protein in red blood cells that carries oxygen. Dizziness, may lead to falls, headache, dry mouth. Feeling sleepy, this may go away with time as you keep taking quetiapine film coated tablets, may lead to falls. Discontinuation symptoms. Symptoms which occur when you stop taking quetiapine include not being able to sleep, insomnia, feeling sick, nausea, headache, diarrhea, vomiting, dizziness, and irritability. Gradual withdrawal over a period of at least 1 to 2 weeks is advisable. That's too short, I'd say. Putting on weight. So this is the very common side effect. So I've gained I'll talk about that later. Abnormal muscle movements. These include difficulty starting muscle movements, shaking, feeling restless, or muscle stiffness without pain. Changes in the amount of certain fats, triglycerides, and total cholesterol. Common, so these are the common side effects that affect like 1 in 10 people. A rapid heartbeat, feeling like your heart is pounding, racing, or has skip beats. Indigestion, constipation, upset stomach, feeling weak, swelling of arms and legs. Low blood pressure when standing up. This camera's crap. Yeah, so increased levels of sugar in the blood, blurred vision, abnormal dreams and nightmares, feeling more hungry, feeling irritated, disturbance in speech and language, thoughts of suicide and worsening of your depression, shortness of breath, vomiting, mainly in the elderly, fever, changes in the amount of thyroid hormones in your blood, changes in the number of certain types of blood cells, increases in the amount of liver enzymes measured in the blood. Increases in the amount of hormone prolactin in the blood. Increases in the hormone prolactin could in rare cases lead to the following: men and women to have swelling of breasts and unexpectedly producing breast milk, women to have no monthly period or irregular periods. So these are the uncommon side effects which may affect up to 1 in 100 people. Fits or seizures, allergic reactions that include raised lumps, swelling of the skin, and swelling around the mouth. Combination of fever, like fever, flu-like symptoms, sore throat, or any other affection with very low white blood cell count. A condition called neutropenia, unpleasant sensations in the legs, also called restless leg syndrome. Difficulty swallowing, uncontrollable movements mainly of your face or tongue, sexual dysfunction, diabetes, change in electrical activity of the heart seen on ECG, electrocardiovascular. Okay. A slower than normal heart rate which may occur when starting treatment and which may be associated with low blood pressure and fainting. Difficulty in passing urine, fainting, that's already said. Stuffy nose, decrease in amount of red blood cells, decrease in amount of sodium in the blood, worsening of pre-existing diabetes. So these side effects are like uncommon, so they affect 1 in 100 people. Now these side effects are rare, so they affect 1 in 1,000 people. A combination of high temperature, sweating, stiff muscles, feeling very drowsy or faint, a disorder called neuroleptic malignant syndrome, yellowing of the skin and eyes, jaundice, no, I don't know what that is, inflammation of the liver, hepatitis, yeah, okay, a long-lasting and painful erection, priapism, swelling of breasts and unexpected production of breast milk, galactor or galactor, I don't know how to say that, menstrual disorder, blood clots in the veins, especially in the legs. The symptoms include swelling, pain, and redness of the legs, which may travel through blood vessels to the lungs, causing chest pain and difficulty breathing. Yeah, sweet medical advice. Walking, talking, eating, or other activities while you are asleep. Wow, okay. Body temperature decrease, hypothermia, inflammation of the pancreas, a condition called metabolic syndrome where you have a combination of 3 or more of the following: an increase in fat around your abdomen, a decrease in good cholesterol, an increase in a type of fat in your blood called triglycerides, high blood pressure, and an increase in your blood sugar, bowel obstruction, increased blood creatine phosphokinase, a substance from the muscles. So these ones are like rare. They affect 1 in 1,000 people. And then there's very, very rare, which is they affect 1 in 10,000 people. So severe rash, blisters, or red patches on the skin. Severe allergic reaction called anaphylaxis, which may cause difficulty in breathing or shock. Rapid swelling of the skin, usually around eyes, lips, and throat. Angioedema. Okay. A serious blistering condition of the skin, mouth, eyes, and genitals. Stevens-Johnson syndrome. Inappropriate secretion of a hormone that controls urine volume. breakdown of muscle fibers and pains in muscles, rhabdomyolysis, myolysis, what the hell? Not known. Frequency cannot be. This is another type of There's another category of side effects that don't have any data. So, skin rash with irregular red spots, serious sudden allergic reaction with symptoms such as fever and blisters on the skin, and peeling of the skin. Toxic. Symptoms of withdrawal may occur in newborn babies of mothers that have used quetiapine and film to classifications. Yeah. It's a long list of some side effects for. Okay, additional side effects in children and adolescents. So these are side effects that occur in children and adolescents. So these are very common side effects. Increase in the amount of hormone called prolactin in the blood. Increases in the hormone prolactin could, in rare cases, lead to the following: boys and girls to have swelling of breasts and unexpectedly produce breast milk. Girls to have no monthly period or irregular periods. Increased appetite, vomiting, abnormal muscle movements. These includes difficulty starting muscle movements, shaking, feeling restless, or muscle stiffness without pain. Increase in blood pressure. Common, may affect up to 1 in 10 people. So the first list were very common, so they affect more than 1 in 10 people. And this is just like common, so they affect less than 1 in 10 people. Feeling weak, fainting, may lead to falls. Well, yeah. Stuffy nose, feeling irritated. Okay, so that was quetiapine and the list of side effects of quetiapine. This is a long video. The reason why I wanted to talk about this was because when I started taking medication, so I've been using I'm quite a physically active person, so I've spent my life in and out of martial arts and sports. And since 2014, I used to be an avid gym goer, and until recently, because of the coronavirus, so regardless of my physical activity, I've always been stuck with weight, and I guess breast development as well. Well, I guess that's swelling of the breasts. I don't know. I used to have some side effects, such as like when I started taking quetiapine in 2014, I think 2013, 2014. I remember like I used to get I take it at night because it helps me sleep at night because it conks me out completely. But I remember having rapid breathing, like a feeling of disassociation. So if you've ever been on medicines where it's just like, I guess the best way to describe it, if you've ever taken Antinox when you're in hospital for like a operation or something like that, and you have like that sort of feeling, it was like that. But this only happened at night because like I took the quetiapine at night. Extreme tiredness, yeah. So extreme tiredness, as in like you physically you cannot walk or anything like that. But I still had to go to work. So yeah, like there's no excuses for not going to work apparently. What else? Difficulty concentrating. Yeah, so it's quite like quetiapine's the medicine that a psychiatrist has to prescribe, not a regular doctor. So you'd have to get in touch. Your GP would have to refer you on to like a therapist or get in contact with a psychiatrist, which is like all the way up the ladder, and then they can prescribe you with this type of medication. Otherwise, sertraline, the antidepressant that I'm taking, that's something that my GP can prescribe because that's something I don't really understand why, but I guess it's more common. But yeah. So the other thing I wanted to talk about, well, I've already mentioned weight. like, because I was an avid gym goer. Like, you can't, like, it's like you can't excuse yourself for having a belly or something like that, because like it makes it incredibly difficult to lose weight, because you're fighting against all these different types of side effects of the medication you're on. I guess I never really looked into the side effects that much before, apart from now. Which is like I had to trust, like I just trusted my doctor really. I trusted my psychiatrist. I trusted my GP, and I was like, after about a month or so, like I was feeling really good. Like I was able to go back into education. Like, I was out of education for 5 years. For 5 years, like I just worked like in a factory and then worked as a steward. So, and even that was hard. Like, yeah, and I guess because of this medication as well, because of quetiapine, like it sort of creates an abnormality in the levels of creatinine. Creatinine is like a waste substance produced by the muscles, and I have to have a blood test every year to like check my kidney functioning. Like it's like a full blood count, I guess. Mainly check my liver functioning and my kidney functioning. And 2 years ago, like my GP came back to me and she said like I have the kidneys of like a 70-year-old. And I was like, what the fuck you on about? I have the kidneys of a 70-year-old. So it's like, okay, so my kidney function is marginally out of whack, like minutely. Like so, yeah. So, but I guess that's something that happens as you get older. Okay, this is a long video, so like it's long because like, I don't think I had to read out the side effects, but I guess it is important because like perceptions around medication is like just it's like you have to take the medic. This is the other perception is like you can't just start and stop. It's like if you're diabetic, you have to take insulin because it takes a while for the medication to have effect. So which is the reason why I'm like, and I kind of have to remind myself that as well because I have to make sure that I take it at the certain times in the morning and at night. It's not just something like willy nilly, like or you can choose to take it whenever you want. It's like no, it's like okay. So if you're diabetic, and you have to take insulin, you have to take insulin jab or something like that. It's like you don't just take it willy nilly because like you're incapacitated by your own by the condition that you have. And the same thing comes from like the medication. Like some of these side effects that I've listed are quite extreme. They're quite bad because it people judge you based on how you look, regardless. People judge you based on how you talk, how you think, what you wear, what your social circle is. So like it's just so it's like there's no, you can't excuse yourself for it. Yeah, this has been a long video. I was going to talk about my journey through depression, anxiety, and obsessive compulsive disorder. Well, I've talked about perceptions regarding medication as well, and I've talked about my experiences in the. Well, I've sort of talked about my experience in the NHS, which is mixed at best. So some doctors are really really good. You could be you could be quite bad. You could struggle to articulate yourself, and you have a doctor who's so experienced, or he's able to judge the situation correctly, and he's able to he or she, they're able to guide you through the process regardless of whether you have 5 minutes or 10 minutes, or regardless of whether you've seen that doctor for a couple of times a week, like only for like it's the first time you've seen that doctor, or you've been seeing this doctor for your entire life. Yeah, so it's like a hit or miss situation really with the NHS, with anything really, I guess. yeah, I'm gonna stop here because like it's too long. I'll be making another video about this, so I appreciate you watching, and leave a comment because I'll read your comments, and I'll make a follow-up video regarding it, and I'll answer your questions or whatnot, whatever. Yeah, so like, share, subscribe. Like, I'm not even a channel. Like, if you wanna, thank you.